Many of us notice changes in our bodies, and one that can be particularly unsettling is hair loss. You might wonder if it is just a normal part of life, or if it could be signaling something more serious happening within your health. It is a natural question to ask, and a very valid one for consideration. To answer directly, yes, hair loss can indeed be an early sign of lupus for some individuals, though it is usually accompanied by other symptoms. It is not typically the only early sign, but it is a symptom that can prompt further investigation. Lupus, a chronic autoimmune disease, can cause the body's immune system to mistakenly attack healthy tissues, including hair follicles. This inflammation can lead to hair thinning, breakage, or even patches of hair loss. There are two main types of hair loss associated with lupus. First, non-scarring alopecia, which is often reversible with proper treatment and characterized by diffuse thinning or fragile hair. Second, discoid lupus lesions, which are red, scaly patches that can lead to permanent scarring and hair loss in affected areas. This type of hair loss, along with the classic butterfly-shaped rash across the nose and cheeks, are often strong indicators. Understanding the mechanisms behind this allows doctors to distinguish lupus-related hair loss from other causes. If you are experiencing unexplained hair loss, especially if it is significant or accompanied by other symptoms like persistent fatigue, joint pain, skin rashes, or fever, it is important to talk to your doctor. They can help determine the cause of your hair loss and whether it might be related to lupus or another condition. Your doctor will likely ask about your full symptom history and may recommend specific tests to investigate further. One distinctive feature of lupus-related hair loss is often referred to as lupus hair. This describes hair that becomes dry, brittle, and fragile, breaking easily and sometimes appearing thin or sparse along the hairline. It is different from typical male pattern baldness or genetic thinning, and it is a key detail that health professionals look for when considering a lupus diagnosis. This specific pattern, combined with other systemic symptoms, paints a clearer picture for diagnosis. Understanding that hair loss can be connected to conditions like lupus empowers you to be more proactive about your health. While hair loss alone is rarely sufficient for a lupus diagnosis, recognizing it as part of a broader set of symptoms can lead to earlier medical consultation and, ultimately, better management and outcomes. Always consult a qualified healthcare professional for personal medical concerns.